Hey, Dr. Alan Christianson here with you. So, can you treat thyroid disease naturally? This is a great question. Almost anyone who's given the option is going to prefer a natural treatment. We want things that are more in alignment with nature, that are more conducive to the body's own natural chemistry, and that are likely to be safer. These are biases that almost all of us carry, and for good reason. So, for starters, let's talk about our definitions, and then we'll talk about how, yes, you can treat your thyroid naturally. So there's two different things people talk about when they talk about treating it naturally. One is being on natural medicine, and one is working to where the body can just work without medicine, where the thyroid can work well on its own. I'll talk about both of those. So the first one is the option of natural thyroid medication. So we call this natural desiccated thyroid, or NDT for short. And this includes brands like Armour Thyroid, NP Thyroid, and prior brands like WP Thyroid or Nature Thyroid. And these are largely interchangeable brands or similar compounds, but this is porcine, which is a fancy way of saying pig, so pig-derived thyroid tissue. That's why we call it natural. It's just taken from pig thyroid. And you might have heard about how pig valves or pig tissues are used for human grafts. That's because at an immunologic level, pig tissue looks like human tissue. We don't reject pig tissue. And at an endocrine level, pig thyroid hormones are the same thing as human thyroid hormones. They make the same ones and in about the same proportions. This was one of the earliest treatments for thyroid disease, dating back well over a century, and it's an effective option. Now, in the modern medical world, it's not a leading option. In fact, it's avoided. It's generally recommended against. The preference is synthetic isolated T4 only therapy. And the rationale behind that largely stems from problems with poorly regulated natural thyroid in the 70s. So back in the 70s, they had the technology to assay the iodine in thyroid medicine, but they didn't assay the active hormone content. With synthetic thyroid, all the iodine is in the hormone. With natural thyroid, it's not. There's more things than just T4 and T3. There's other biologically active components. That's part of why it's better. But if you assay the iodine, you can't regulate the hormone just by that step. So the old process was to assay for iodine. And there was a very pivotal paper put in the Journal of the American Medical Association in 1979 showing that it was a story of a woman who was sadly undertreated. She was on a type of medication that should have been adequate for her needs, but it clearly was not. She was suffering. And it really just lambasted the poor quality control and the poor regulation of natural thyroid in that time. And the criticisms were fair for that time. But that spawned a new evolution in assaying of thyroid medication. And now thyroid medications are assayed by measuring the hormone content, not by measuring the iodine content. So when you hear doctors say that thyroid hormones, the natural ones, are not as well regulated, that was a fresh argument during the Carter administration. That's not a fresh argument today. It's not even true anymore today. In fact, there was a large study done at Kaiser Permanente in California a few years ago, and they pulled records on a whole bunch of people on thyroid medication. And they wanted to see whether or not natural thyroid was as easy to regulate as synthetic thyroid was. So they looked at people that were on synthetic, looked at those that were on natural, and it just saw, how often they needed retests, how often they needed prescription changes, how stable their levels were. What they saw was that there was no difference. The whole story about natural thyroid being badly standardized and not easy to get regulated, it's just not true. The conventional doctors talk about that like a telephone game. They repeat it, but it's just not true. The conventional studies show otherwise. But is there an advantage to it? Well, another recent study took a group of people that were on thyroid treatment, and it swapped them back and forth between synthetic T4 only and then combination thyroid. And they didn't know what they were taking when, and they went back and forth a few times. But they were asked how they felt, asked about their concentration, asked about their mood, and which pill do you feel better on? So they didn't know what pill they were taking when, but the vast majority of people, over 60%, said, hey, I feel a lot better on this pill for some reason. And that was the natural one. It didn't happen like that for the synthetic. So yeah, the vast majority said they felt better on that, not knowing they were on it in a blinded study. And there's reasons why that could be. The natural contains T4, but it also has T3, T2, and at least a dozen different biologically active thyroamines. There's a lot of stuff in there. This is kind of like a brown rice versus white sugar argument. Natural things contain a whole host of secondary cofactors that make them work differently than isolates. And that's why many can do better from that. There was a small trial we did in our office in which we measured basal metabolic rate among people. And those on synthetic thyroid versus those on about the same amount of natural thyroid burned about 300 calories more per day. So their passive calorie output was higher just by taking a different pill. So yes, there are those that do better on that. The question is it a safe option for people? There are people that have cardiovascular issues that make it to where they probably shouldn't take medicines that contain T3. So those that have severe cardiac dysrhythmias, those who are well over 65, there are some circumstances where that may not be a good fit. But barring those circumstances, natural thyroid is a safe, viable option. Now, the dosages are quite different, and you can't just say if you're on this of that, you need this of the other. But there is a process that doctors can take someone through. So if doctors know how to use natural thyroid, they can substitute someone and they can work and adjust and get them to where they are stabilized. That's totally viable. So yes, it can be treated naturally in that sense. Now, what about the other definition of treated naturally, like can your body take over by itself again? Well, for that one, there's those on medicine and those not yet on medicine. So those not yet on medicine, if we're talking about someone that doesn't have a thyroid, they need medicine. End of the discussion. And if someone's thyroid is basically shutting down, their TSH has gone through the roof, their free hormones are down in the basement, they're below range, well below range, not like low normal, that's not very meaningful. Those cases, they may benefit from medication. They might not need it, that might not be their only option, but it could be helpful. So even in those more severe scenarios, studies have shown that about 80% of people can regain normal thyroid function without medication, just diet only. One of the larger studies saw that within 3 months, 78.3% of people with severe hypothyroidism regained normal thyroid function just by diet. So yes, the thyroid function can come back again in most cases. That's been shown true for Hashimoto's disease, for overt hypothyroidism, and for subclinical hypothyroidism. So in that sense, yes, you can treat it naturally as well. It is, of course, important if you've got severe thyroid disease to be under the guidance of a doctor and let them monitor and track and make sure you're getting proper progress. But in almost all cases, you can treat naturally, whether it's natural medication or whether it's diet and lifestyle therapy. And this is a thing, we learn more over time. And we now know that the body and the thyroid is more resilient than we ever thought. And there's more capacity to heal and repair. So this is great news, and I'm happy to be able to share it with you. All right, take great care. We'll talk again really soon. Bye-bye.